What drives a researcher to investigate a problem? Why are some studies aimed at exploring a new phenomenon while others actually focus on testing a theory? Now, the objectives of research can help us understand not just what we study, but why we are studying it. In this lesson, we're going to examine the four broad objectives of good research and how they shape the direction and design of any scientific inquiry. Now, the purpose of research, let's just explore that. At its core, research is about discovering truth. It seeks to answer important questions using systematic, scientific procedures. Now, while each study may have a unique purpose, all research shares the broader aim of contributing to knowledge and solving problems, whether they are personal, social, professional, or academic. Now, let's explore the four major objectives that guide most of research activities. The first is exploratory objective. The first major objective of research is actually to gain familiarity with phenomenon or to develop new insights into it. Now, this type of research is called exploratory research, and it's especially useful when a topic is new or it's not well understood. So the researcher then explores the subject without any fixed hypothesis, often using open-ended methods like running interviews or using case studies. For example, if a psychologist is investigating a newly recognized behavioral pattern in adolescents, exploratory research actually helps them to ask the right questions and identify the relevant variables for further study. So let's say there's this new phenomenon that they've been observing in adolescents, an increased, something that's come up right now is an increased dependence on ChatGPT, and it's called ChatGPT neurosis, where people just completely depend on it and believe everything that ChatGPT says and act accordingly. So suppose this is a new phenomenon that's popped up and no one has seen this happening before. There's no precedent before in history. You don't even know what kind of questions to ask in such a scenario. So what you would do is maybe just do exploratory research where you're asking people questions, people who've been affected by it, who've actually believed what was said. If there was anything untrue, then they believe in it, and then you ask them the questions: what happened to you? What did you feel when this statement was made? Why did you believe it was true? And further questions like that, which helps you understand the context of what is going on and understanding what variables are involved in it. So variables would mean what are the elements of this particular situation here? What are the various factors that are influencing the people here? So this is how you would do an exploratory research. So you're basically just asking questions and trying to figure out what's going on. Now, the second one is descriptive objective. Now, the second objective is to portray accurately the characteristics of a person, group, situation, or phenomenon. Now, these are known as descriptive research studies. So the goal here is not explaining the causes of something, but actually to paint a clear picture of what is this and why it exists and what exists at this time. So you're basically making a description of the situation here. And you would do that using surveys, observational studies, and demographic analysis. Most of these studies usually use these aspects to understand in detail what's going on. For instance, describing the lifestyle habits of elderly people in a community actually helps researchers understand their needs and behaviors without trying to determine why those habits exist. So all we're trying to understand is their lifestyle habits. We don't want to find out what causes those habits. Why do they want to have a cup of tea at 10 a.m. in the morning? Or why do they usually prefer to socialize and have tea and snacks together rather than just sitting and reading a book? They don't want to understand the why of the observation. They want to understand where and when it's happening. So then there's the diagnostic objective, which is the third one. The third objective, which is the diagnostic objective, is actually to determine the frequency with which something occurs or to find out how it is associated with another factor. Now, these are called diagnostic research studies because they aim to uncover patterns, associations, or correlations. So these studies can actually highlight the prevalence of a condition or the factors that are influencing its occurrence. So we're basically trying to understand why is something happening here? What are the factors that are influencing its occurrence? How does it occur? What causes it to increase? We're trying to map that over here. An example would be a study that investigates how often workplace stress is linked to sleep disorders in corporate employees. So then we have the fourth one, which is the hypothesis testing objective. Now, the fourth and perhaps most rigorous objective is to test a hypothesis. And that is, it's all about causal relationships between variables. So when you say causal relationship, cause and effect relationship is what it means over here. These are referred to as hypothesis testing or experimental studies. So the research actually begins with a specific hypothesis saying if this happens then it will cause this. That's how a statement is, and then they test it under controlled conditions so that there are no external variables that are influencing it, only the conditions that you, or the aspects that you, or the elements that you feel are actually involved in creating that result. So these studies often use experiments, control groups, statistical tools to determine cause and effect relationships. An example would be a psychologist who's running a test to understand whether a specific therapy technique actually reduces symptoms of anxiety compared to a control group that's receiving no treatment. So in this aspect, we're actually trying to find out whether this new therapy technique causes a difference or actually has an impact on anxiety or not at all. So we're having a control group where the treatment is not given, so we can analyze and determine whether there really is a difference.